The environment has to be changed.
What we're saying is have a heart.
We've got to be able to regenerate our
There'll
competence.
be people who are kind, people who are cruel, but that's life. You can be bigoted about bigots. I'm fine with that.
But starting so young, I think this has led to some young people being hooked on to the need for improvement, and this is where we want to talk to Ee Lian about this. There's a condition called BDD, right?
Body Dysmorphic Disorder.
Yes. Now, what sort of percentage of young people are affected by this?
It's Body Dysmorphic Disorder.
What is it?
It is a reaction that is out of proportion to a perceived flaw in one's appearance or body shape.
Which means that no matter what's done to them, they still think it's not good enough?
If they suffer from BDD, there is a huge risk that no matter what is done, it will never be good enough,
It will be unhappy.
It would be transferred then to another part of the body.
Okay.
Then you run out of parts of the body.
It's a never-ending cycle.
Yeah.
So it's like the beauty version of anorexia?
It often starts in adolescence. The bud
Yes,
of
so
the
when you
disorder
start young, you
starts in
implant that.
adolescence, and it continues to all the way to quite an elderly age. In the general population, it's only about, depending on which study you quote, between 1 to 3%. So it's quite low. But in the population that ends up in your waiting room, it can be as
Could
high
be
as
higher.
10 to 15%.
But you know,
Have you
okay, I think
encountered any of
this,
these?
okay, so this might be a little bit controversial, but personally I feel from all my years of experience, I feel that the incidence is low. In my own practice, I don't feel that I have encountered many patients with this, and I don't think it's higher than your general incidence of 1 to 3%.
Have you encountered?
I think it's maybe higher than 1 to 3%, maybe not 10, 15%.
Then how do you treat those people?
It's very difficult to treat them, but I have seen quite a number of BDD patients, and they're a little scary. I mean, you try to get them to seek psychiatric help, but invariably they do not want, and they will tell you there's nothing wrong with me.
It's called
How
no
about you,
insight.
Bernie? Because yours is non-invasive.
I would say that because the risk associated with non-invasive work is less, so usually it comes more like the line is a bit more grey because it can be more like a maintenance issue. Yeah. So but in general, I would say the number is quite small, and usually if they do present with this type of problem, we would refer them to the psychiatrist.
I had a patient some time ago who was obsessed with improving her looks, but she had already been to see many physicians, doctors, surgeons.
How old was she when she...
She's about 35.
So this
And she
condition
was already
started late?
very deformed looking,
Okay.
but she had no perception that she looked deformed, and she said, I want my lips to be bigger. They were already huge. And when you declined to do something for her, she would go somewhere else. She would come back 6 months later and she would look different again. And you say, look, I'm not going to treat you. You need to go to see a psychiatrist. She'll say, there's nothing wrong with me.
So what happens to these people?
So these patients, what happens to them?
Yeah.
As responsible plastic surgeons, Martin will agree that we turn them away.
Should there be stronger regulations, laws to handle such people?
But you can't force them, you know. You can't force a person to go for treatment.
In BDD, the belief that there is something flawed in their body is so strong, it can override any logical explanation or persuasion from the doctor, the family members, etc. And extrapolating from Morphel's example, it is considered a disorder because it spills over and affects many other areas of their life functioning, social life, work functioning, etc.